And it started by enrolling patients with metastatic breast cancer that were about to start first-line chemo. They were given what was termed a screening circulating tumor cell test with cell search. All of the literature to date shows that patients with less than 5 CTCs are on a very favorable prognostic course. And those patients were put in Arm A, and they were about 50% of the patients that were enrolled. Conversely, 50% of the patients had greater than 5, and 5 is the cutoff for making a decision with circulating tumor cells in our test. These patients now became the focus of the study, and they were started on their indicated chemotherapy. 3 weeks later, a very hard stop, they came back for another circulating tumor cell test. All of the literature to date, including the very first trial back in 2004, showed that the levels of circulating tumor cells can change in the blood, and most likely that reflects a response to therapy. So in these patients that started out greater than 5, if they dropped the number of CTCs within 3 weeks, that's a favorable sign. And they were now on Arm B, and they were followed to outcome. The focus of the study then became Arm C. These patients before therapy had greater than 5, after therapy also had greater than 5, persistently elevated. These patients were then randomized to either continue on what was apparently ineffective therapy or switched to the next line of chemotherapy. And that was the intent of the trial, to show that after 3 weeks of start, you can impart a survival benefit on those patients.